dignitaries, delegates and participants, ladies and gentlemen, namaste and a very good morning to all. I'm Dr. Sai Lakshmi, your host for this morning, and it is my honor and privilege to welcome you all to this conference on accessible and affordable rural healthcare models presented by Prashanti Balamandira Trust in association with Sri Sathya Sai Sujala Shravanti Trust. We also take this opportunity to welcome the dignitaries on the dais. Dr. Arogya Swami Velumani, founder, former chairman and managing director of Thyrocare Technologies Limited. Hearty welcome to you, sir. Dr. C. Sreenivas, chairman, Sri Sathya Sai Health and Education Trust. Sadguru Sri Madhusudan Sai, social and spiritual leader, founder, Sri Sathya Sai University for Human Excellence. We request our dignitaries to kindly come forward and light the ceremonial lamp, signifying an auspicious beginning. Postgraduate boy students of Sri Sathya Sai University for Human Excellence will chant verses from the Narayana Upanishad as part of the invocation.
Shri Gurubhyo Namaha. Om Sahana Bhavatu Sahanau Bhunaktu Saha Viryam Karavavahai Tejasvinavadhitamastu ma vidvishavahai. Om Shanti Shanti Shanti. Om Atha Purusho Havai Narayano Kamayata Prajasrijayeti. Narayanat Prano Jayate Manas Sarvendriyani Cha. Kham Vayurjyotirapa Prithvi Vishwasya Dharini. Narayanad Brahma Jayate Narayanad Rudro Jayate Narayanad Indro Jayate Narayanad Prajapatayah Prajayante Narayanad Dvadashaditya Rudra Vasava Sarvani Cha Chandagumsi Narayana Deva Samutpadyante Narayane Pravartante Narayane Praliyante. Om Atha Nityo Narayanaha Brahma Narayanaha Shivascha Narayanaha Shakrascha Narayanaha Dyava Prithivyav Cha Narayanaha Kalascha Narayanaha Dishascha Narayanaha Urdhvascha Narayanaha Adhascha Narayanaha Antarbahishcha Narayanaha Narayana evedagam sarvam Yadbhutam yaccha bhavyam Nishkalo niranjano nirvikalpo Nirakhyata shuddho deva eko Narayanaha Nadvitiyo osti kashchita Ya evam veda Savishnureva bhavati Savishnureva bhavati. Om Sharire jarjare bhute Vyadhigraste kalevare Aushadam janavitoyam वैद्यो नारायणो हरिः ॐ शान्ति शान्ति शान्तिः हरिः ॐ तत्सत् श्री साईश्वरार्पणमस्तु।
It was Mahatma Gandhi who said that India lives in its villages. Nearly a century later, this statement holds good even now, with nearly 64.6% of rural population. This conference aims to discuss and deliberate on key aspects of rural healthcare so that we, as a nation, move towards sustainable development in the true sense. The role of pharma industry, using technology to bridge the urban-rural divide, providing equitable resources and opportunities, integrated and preventive healthcare strategies to reduce the cost burden. Today, the cost of healthcare delivery, tertiary care in particular, and medical education in India have skyrocketed, with one leading the other in a vicious cycle. Aiming to turn this instead to a unique virtuous cycle of paying it forward, we also take this opportunity to present the world's first medical college that will provide both medical education as well as medical care absolutely free of any cost. With policymakers, medical personnel, pharma giants, cutting-edge medical technologists and entrepreneurs all seated here, this gathering in a way represents the healthcare system of India, and we take this opportunity once again to thank you all for being here today, and thank you for all your contribution in whichever way possible to the healthcare system of India. As we gear up to celebrate Azadi Ka Amrit Mahotsav, the 75th year of our independence, let us collectively aim and work towards a Swasth Bharat, a healthy India, and a Samridh Bharat, a wealthy India. After all, people and their well-being is the greatest asset for a nation. On that note, we will have the inaugural video.
It is said that health is one's greatest wealth, and yet in India, rural healthcare remains one of the biggest challenges facing the country. More than 60% of the population living in rural areas, healthcare for them is a distant dream hampered by unaffordability and inaccessibility. This difficulty is perpetuated by commercialization of not only medical care but medical education itself. The Economic Survey 2020-2021 reveals the dire situation of medical care required. It shows that despite efforts to increase public institutions, around 74% of outpatient care and 65% of hospitalization care remains provided through the private sector in urban India. It is on this path of purpose the Sri Sathya Sai Sanjeevani Child Heart Care facilities in the Indian states of Chhattisgarh, Haryana and Maharashtra were established in the last 10 years, and the Sri Sathya Sai Sarala Memorial Hospital at Muddenahalli here in Karnataka was dedicated to the nation. Services across all these healthcare facilities are offered absolutely free of cost. The prolonged pandemic battle since March 2020 brought all the stakeholders of the country together: government, private sector, social sector and communities to build efficient and accessible healthcare solutions. The COVID-19 pandemic has highlighted the need to collectively nurture a more holistic healthcare system with healthcare workers at its core. Infrastructure for serving the masses can be built in a short period of time, but trained, qualified and empathetic medical professionals willing to serve in rural India continue to pose difficulties. Though medical schools in India produces the largest number of doctors than anywhere else in the world, the availability of these specialists is post a conference entitled Swasth Bharat, Samriddha Bharat. Healthy India is a wealthy India. With participation from the who's who of the healthcare industry, this conference will witness a convergence of expert professionals to deliberate on the topics of integrated healthcare delivery models, to develop medical education programs that incorporate training in social, psychological, emotional, cultural and spiritual aspects of medical care to explore the use of novel technology to expand the accessibility and affordability of medical care for underserved and marginalized populations in low-resource settings, and covering many other topics. Through this conference, we are certain that the dream of universal access to quality healthcare will indeed be one step closer to becoming a reality.
We now call upon Dr. C. Sreenivas to give the welcome address and introductory remarks. With over 30 years of expertise in establishing world-class healthcare institutions that provide quality healthcare without any barriers of social or economic status, he currently leads the Sri Sathya Sai Sanjeevani Centers for Child Heart Care that address the national burden of congenital heart disease through their preventive, curative, training and research programs. Dr. C. Sreenivas.
Offering our pranams and reverence at the feet of Bhagwan Sri Sathya Sai Baba, revered Sadguru Madhusudan Sai, the much venerated Dr. Velumani sir, distinguished ladies and gentlemen, many faces of whom that I'm so happy to see here in the audience, and to those of you I've not had the privilege to see you in person. I want to place in front of all of you that not 30 years but 44 years of my life in healthcare you have touched, benefited so many millions of lives in all that you have done and your predecessors have done. The beneficiaries whose names you may not know but have passed through institutions that we run all across India and in several parts of the world is predominantly, if not entirely, to what you have done in your fields of life and in your endeavors of the varied spectrum so importantly we today represent at this conference. I think this is really a conclave of everything possible that can comprise the word health, healthcare, healthcare address and delivery. Health, as was defined by Bhagwan Sri Sathya Sai Baba and greatly endorsed by Revered Madhusudan Sai, is first not about hospitals. It is how to prevent you to get into hospitals. Health, he always believed, was about wellness, about well-being. But sadly, as long as there is human life, there is illness, there is disease, and there is a need for a hospital, which is where all of us individually and collectively have a role to play. A welcome indeed to what one would think is the most appropriate place for all of us to gather. Sathya Sai Grama is essentially a sacred place, and I think the nobility of medicine and healthcare should always stem and begin at the feet of sacredness, because essentially we address life by either alleviating suffering or removing pain or curing an illness. And somewhere we just become instruments of an act which is destined to happen and benefit these beneficiaries. Sathya Grama is that unique piece of Mother Earth where I think all of us as constituents, when we gather, we will realize that the whole is much larger than the sum of all the constituents we make up. Always the sum is very different from the whole. And I think that is what makes Sathya Grama the right place for us to meet. Because here, if you just see the entirety of the canvas that we will be possibly in a very microcosmic way witnessing is, right from the womb, sadly to the tomb, you will find address here. Before there is the formation of a fetus, to the entire journey of that the human being goes through in a span of life, gets addressed in this sacred presence. Swamiji, in his varied institutions, which serve as an epicenter but move and digress into the entire spectrum of the region, the district, the state, the zone of South India, and the entirety of India. I must also make a correction, dear sister, that today Swami's healthcare spans right from Jammu down to where Madurai Meenakshi exists, right from where the most remotest part of East India is represented by these people at this table, to almost Kutch in Gujarat in India, our healthcare spans today. Be it preventive healthcare measures, be it working with Anganwadi workers, Mitanins, Sevikas, in possibly thousands of primary healthcare centers of the country, Swamiji and Sathya Sai silently but significantly is present. One of the greatest contributions that we make very silently is at the base of the pyramid, the primary healthcare system of the country, which very often goes unnoticed in the din and glamour of tertiary care, which is the apex of what healthcare or hospitals today have become. Empowering, educating, and employing at the primary healthcare level begins the foundational work of the healthcare ecosystem that we are addressing. Serving the underserved, reaching the unreached will only then enable us to serve the purpose why we are here, which is to do the undone. I would also add, coming to the sacred presence is like what Khalil Gibran says, and I think that would be something you would hold as testimony in the evening when you choose to leave. That you will return as different persons and people from whom you entered and gathered this morning. I say that on purpose because that is an experience we will all go through, which is essentially transformational when we come here. You will get a new understanding which will touch the very core of our hearts, first as human beings, then as healthcare providers, when we address what we are going to address in a very new, refreshingly different way. What happens in a hospital is what all of us collectively do. From the time anybody of any age or from anywhere comes into a hospital, I think everybody in this room has a role to play. Whether it is an entry into the hospital, which goes as an edifice of a design and a building, I think there are people here who work in that. Through registration processes of hundreds and thousands of patients that come to our own hospitals for that matter, and to many hospitals and institutions of healthcare all over the country, I think you're all present. Diagnosis, prognosis of problems is the first step when you come to an institution, and that I think whether it is medical technology, whether it is equipment, diagnostic tools, both within edifices and now predominantly remote operated, virtual healthcare, metaverse healthcare today, which is paradigmly different today, role of artificial intelligence in possibly everything that encompasses health today. Today, cardiac surgeons take up courses on artificial intelligence as a core subject in many parts of the world today. So the dynamism of spread and speed at which healthcare address is moving is just mind-boggling and mind-blowing. Then essentially pharma, and I have to smile at my dear brother sitting here, who's got a heart of gold and a mind that envisions, and more importantly, a will to serve the community. Undoubtedly, pharma is all pervasive in hospitals. Where is there a ill without a pill? You have to have pills to cure sadly ills, and I think pharma has a huge role to play. Surgical roles in the form of expertise, equipment, instruments, instrumentation pretty much form much of the operative and surgical work we do in every specialty and subspecialty. Post-operative care, pre and post, intensive, critical, palliative, again, form integral parts of healthcare today. But what I would like to submit to each one of you here is, health for us does not end when a patient comes to a hospital, gets cured and goes. Health for us begins when the millions leave our hospitals. Because I think that's where we need to address the purpose of this conference. Impact is what health is all about. What does your medicine do? Your medicines, I might submit in gratitude, have cured millions of whom you do not know. We have seen their faces, we have seen their pain, we have seen what they go through, and we remember you when you have provided that to those in pain and in need. Impact becomes important because we want to study what the power of your medicine was. You took so much of study, research, effort, enterprise to make that medicine and make it in millions so that it can reach out to ever so many. But what happens to that diseased when he is cured? In terms of what productivity does he go out with to himself, to his family, to his society, to his community, to his state and his nation, is the greater intangible debt of gratitude he pays each one of you. And we become instruments of conduit for that, for the pharma industry. This enterprise also addresses, say, medical technologies. Today, technology is all pervasive in health. Where does this get used? In hospitals. While The best of equipment is made by many of you sitting here. We are privileged to see the use of that equipment, not as it comes out of your well-done factories or equipment making institutions, but in the hospitals, into the war fields where we operate. It is there that these millions get the benefit of your equipment and your medical technology. There again, I would say, I will offer that gratitude to all the medical technology companies that have made medical equipment and continue to upgrade them, upskill them and upscale them for the betterment of healthcare, information technology, and finally medical education. This thought, whose time has now come, of the concept of creating a rural medical institution for the rural youth, for the benefit of the rural unserved masses, which is the purpose of this conclave, is an idea whose time certainly has come. It is not a new idea, we all do know, but I think giving shape, form, structure, and the audacity of hope to make it a reality deserves a complimentary applause. Medical education, again, undoubtedly, as we all know, that many of us as doctors needs a total round the head turn to what it is doing and what it ought to do. To blend nobility with ability, to blend competence with compassion is what this institution is aiming for, and without a doubt one day will make it a success which we will all celebrate. Never underestimate the power of each one of you as to what you are doing to thousands and millions you do not ever get to see. It is those who work in the front line, those who work in the institutions, those are ones who benefit from all that you are doing. So I thought I'll leave you with one proposition here. It was a thought that I had about 40 years back when we built one of our first hospitals. We had, let me cover the canvas of all that were present there. On medical technology, I had Philips, Siemens, GE, Hewlett Packard, and I can't remember who all. So we had a meet of all the heads, and then if I remember it, Jeff Immelt took over as the head of GE worldwide at that point. The Dutch ambassador and I can't remember the names, it was about 40 years back. So we all gathered. So we thought of a model. What if medical technology companies, what if pharma companies, what if information technology, which was just making its inroads, health education experts, and a team of doctors that encompass the entire scope of work that we were doing in the hospital. What we sat at a round table like the one which we sit here together. First, there would be no across the table negotiation. We would all sit around a table to address a singular cause together. This was a proposition that I thought of, that wherein medical technologies, pharma, and all that goes into the working of a hospital, to the making of a doctor, and of doing what we wish to do from there on. If we all became one comprehensive, cohesive unit together, and we all became equitable stakeholders for the address of what we were doing, how would that be as an approach? First, it would build tremendous economic value. From the time we started to the time we are in now, if you see the amount that gets spent today in health, even just by a small institution like us, runs into several hundreds and hundreds of crores in a matter of 1 quarter. That is our spend by a small institution like ours. If we were all in this together, which we are, if we all addressed this together and there was no across the table, but we were all one, which I would open my arms to each one of you, that we are all in it together. That's why we are all here together. We as healthcare providers need you. And we want you to enjoy the benefits of what you have done through the use of whatever you give us. So we wish to make this a complete 360-degree approach, wherein right from the investments we make into preventive work, right up to curative work, and tremendously where we are getting to be very, very strong into research and innovation. If you make all this beneficiary, research to bedside to prevention, if all this become one and sits at a round table, I think that is the conversation and dialogue we must have here this morning. And I think in the evening, there will be a new narrative that which will come out from all of us. So I think Khalil Gibran will be proven right with this thought processes that we will go through, and with your panel discussions, I think there will be new thought processes, new ways to approach a problem. The greatest need is what you're going to find here. We are nothing but integrators of goodness and service to community and society. That's all that Sathya Sai is. That's all that Madhusudan Sai is. We are just integrators of goodness and good people for the benefit of community. It was mentioned that all services here are free of cost. Yes, they are free of cost only to the beneficiary or to the patient in need. Yes, we are often described as hospitals without bills. There is only dil, bina bill. These are common words that are attached to us, but that is just one side of it. But I would also endorse that finance and money has its own place of importance. Dhanam moolam idam jagat is also a virtue, and we respect that and we have the greatest reverence for that. It is money that gives us the ability to work and the ability to do what we have not done. We recognize that importance, but the segments that we serve, she said, it is not 60, but I think it is more than 75% of India's population still suffers from inadequate, almost improper care, whether it is in expertise or equipment or the necessary bridge that is very wide between what is needed and what is delivered. I hope in our conversations we will be able to reflect upon this, think upon this, and come out with an action plan. What we have here is massive need for you. We have enormous need for the pharma industry. Our need in terms of, I hate to say this, but in terms of money itself runs to over hundreds of crores every year that we need from the pharma industry, that we buy every day, which we will continue. That's a requirement for us and that's part of our work. But can we redefine this approach by giving you the benefit of those beneficiaries that we will show by the giving of your medicines and what you make? And the same applies to every segment and stakeholder that is addressing healthcare. This is my submission of a proposition to you during the course of your day. God bless and Godspeed in all our efforts. Thank you very much.
Thank you, sir. Thank Thank you, sir, for very beautifully and eloquently encapsulating and elucidating the purpose of this conference. We now request Dr. Arogyaswamy Velumani to deliver the keynote address. He is a scientist and entrepreneur born in Coimbatore to a family of agriculturists. After bachelor's, he went on to pursue his master's and doctorate degree while working at the prestigious Baba Atomic Research Center in Bombay. He later went on to start ThyroCare in 1996, which is one of the biggest diagnostic chains in India and today has grown magnifold. He is a founder and managing director of Nuclear Healthcare Limited, a radiology diagnostics company affiliated to ThyroCare. Dr. Velumani.
Pranam Sadguru ji, Namaskar ji, and all dignitaries, experts. I'm extremely happy to be here and that to be also talking, giving the keynote address. What qualifies me to be here is I was born poor. Agriculturist family is a wrong terminology. We had been doing agriculture without lands. My father was neither employed nor employer or employee. My mother, a lady with guts, grits, had 5 children, no income, but she managed to rear 2 buffaloes, 10 liters of a milk a day, ₹1 a liter, 10 rupees a day, 70 rupees a week. She made sure she never borrowed from anyone, and she put all of us in Madras University as graduates and in Mumbai University as postgraduates. We had wonderful chief ministers, past tense. Mr. Kamraj was chief minister of Tamil Nadu who brought meals to the schools. Had he not brought meals to the schools, I would have not gone to the school. So even if I get 10 minutes to talk, 1% of my time for him, to thank him for providing that. When I walk or when I drive through the villages here, I realize plenty of mothers with similar kind of buffaloes or goats. So it truly emotionally connects me. When I came here a couple of weeks back, I realized it's not that simple to declare education free and also healthcare free. It's huge commitment. India, as told, 75% of the people don't have an income of even a $3,000 per annum, whereas we are competing or looking at a world which has got even $50,000 per annum. Intimidating. But I must very confidently tell you, everything is possible. If I, from a village, take a pyramid of 10 slices of economy, I was in the bottommost slice, and I myself have come up to the topmost slice without anybody's truly patronizing me by hard work. And I am pretty sure many can do, almost everybody can do, and it is what all needed is make them to believe that it is possible. And let me address a few things because it's a keynote speech. Education, yes, it is commercialized too much. We are only teaching the rich. All government schools are dying, and all in English convent education is only given a lot of importance. Second one is health. Yes, every rich can have options, poor don't have an option. I'm from a village, still people are dying without knowing what is the cause of the illness. When they ask, did he go to the hospital? No, because though they have a very little money, they know that once they go there, whether that costs 1,000 rupees or lakh rupees or 10 lakh rupees. So it's a huge trust gap between the common man and the doctor, which is making health almost impossible in rural villages. Nutrition again is two kinds. One is, does he get right thing to eat? The second one is, does he get to eat? So in this country, we have still a lot of people who don't get enough to eat. So that needs to be addressed. And all the three, the core values of this organization makes me to feel that this organization has chosen the right priorities, and I'm sure it will reach where it should. Yes, huge divide. Again a pyramid. Rich is in the top, poor is in the bottom. Rich is few, poor are millions. Rural and urban, as he said, 75% is in the rural. Affordability, again there is a pyramid. Somebody can afford anything. They can fly from here to anywhere and come back, pay to the best of the hospitals. There are some who cannot even go to the nearest GP because they don't have that much to even spend on. Accessibility is another pyramid. In Delhi, in one road, there are 7 cyclotrons. Each cyclotron is for $4 million. And there are some states, UP, Bihar, in some states, there is no cyclotron at all. What does it mean? Inequality. Pyramid. Awareness, there is a pyramid. People are treating a small deficiency and going to the doctor regularly. There are people with tuberculosis which they don't go to a hospital at all. So to that extent, everything is pyramid. Pyramid means the gap between the top and the bottom, which is the biggest challenge. There are two problems. One kills, straight kills in healthcare. It is very safe to get straight killed. But the one does not kill, harasses and then kills. So this is to be understood. We need to look at the preventive side, find out what does not kill but harasses, and make sure that that doesn't harass. How long we live is not important. I think still I remember one of the dialogue in the old picture. Jindahi badi honi chahiye, lambi nahi. I don't know the dialogue, which picture it was. Severity, it is a pyramid. In incidence is another kind of pyramid. And let me address only two problems. One is tuberculosis. Another is but not early. It takes you through the entire pathway. Organs one by one get put off, and then finally different problem. This is more of a rich man's problem. Of course, today you see it is there in every age, it is there in every economic strata, but it is by and large rich man's problem. Tuberculosis is poor man's diagnostics, which is my area. And I must tell you, diagnosis is the very important aspect in entire healthcare delivery. Mine is the oldest web server in entire healthcare industry. That's why I have done very, very powerful. Today you have got, literally speaking, for 1 billion people have mobile in their hand, and majority of them have very important. Healthcare actually does not cost anything other than HR. Every 30% is delivery, delivery is HR. India has the huge population. I can say it from this year because we have overtaken China just now, I believe, at this year. Which means we have the, why only in India? We will only have the power to change the world. Logistics plays a huge role. Running a hospital, doctors, experts, everywhere, everybody is here. But this is not the country. The country needs huge logistic. Blood sample has to come from all over the country. I had a single laboratory in Navi Mumbai. From 80 airports, every night, same night, my scientist qualifications. It is nothing but volume. Volume is denominator. Everything is divided by the volume. So, if we had 100,000 Mumbai, it is 5,000 rupees for the consignment by air. If you have only 50 samples, anything we have to succeed, we have to scale and do volumes. Efficiency is everything. I address from the floor efficiency. If it comes from the customer pocket, it can be going, and you are the tallest, you are the strongest. So this is how I believe the priority. Write the most important in the top. Only lot of things in the priority. Company, a $1 billion company, listed company, and never had a debt in that balance sheet. Frugality. Trust me, it is possible. If you work, create jobs. जो काम करते हैं वो बुढ़े होते हैं, जो काम कराते हैं वो बड़े होते हैं. So get the working. Jobs is solving problems. If you want to reach to the bottom of the pyramid and create impact, you need to truly create jobs. COVID has taught us a lot of lessons, and one most important lesson, the day it was declared private labs can do RT-PCR test, in the first list on the country, first lab among the 5 labs was Thyrocare. We found the PCR test reagent cost was 1,500 rupees. Trust me, I knew very well this 1,500 is exaggerated, greedy rate. All of you will be shocked to know today it is only 50 rupees. 1,500 rupees to 50 rupees within a matter of 12 months. What drove it? Demand supply, volume, because all patients were in the ICCU beds, everybody started making. So, what it says, cost what is seen, heard, bought is exorbitant. Everything can be brought down if you have volume. Wow, how did I make a great business? Because retail rate of thyroid testing reagent was 150 rupees per patient when I started the business. This is for a man who does 100 samples a day. I did 100,000 samples a day. For me, the cost was 30 rupees. Is that very clear? A lot of things can be managed as long as you have volumes. I talked about 2 diseases. One is tuberculosis. Tuberculosis cannot be taken to the field. It has challenges of technology to diagnose. Diagnosis is fairly well happening, though very often late. But after diagnosis, treatment is not properly done. It's a long treatment, 3 months treatment. It produces a lot of harsh effects in the body, and the patient is tempted to discontinue. Before the treatment, if it discontinues, it becomes MDR, multi-drug resistance. Then if he still continues another course of disease treatment, he again discontinued, it becomes XDR. That means no medicine will work. If no medicine does not work, and if he is not isolated, he keeps infecting that XDR to hundreds and thousands of people. We are going to have problem. So we need to have diagnosis as centralized diagnosis, genomic sequencing, whole body genomic sequencing, which will tell which medicine will not work. Because all medicines don't work. And if he is in a wrong medicine, he is harassed, no outcome. A lot of things are there, but that I want to talk about it is a centralized, because a whole body genome sequencing machine costs roughly around $1.5 to $2 million. Specimen can fly. Diabetes, that is not centralized, that's taken to the field, because what all you need is a 3 rupees, 4 rupees glucose strip, a glucometer, a HSC pass, preferably a female, who will diagnose and who will warn the patient, aapko diabetes hai. At least he will not consciously eat the glucose, the sugar, the carbs. So it's very, once known that he is diabetic, half of his problem is solved. Even that is done, it's a great contribution. India has 10 crore diabetes people, at least half of them are not diagnosed. India has 10 crores unemployed HSC. Is the problem solved? It's all is needed is to connect, as Dr. Sreenivas said, we only connect people and deliver, and this is connecting people and delivering. What we need is one nurse, trained nurse, even if not qualified nurse, trained nurse, one nurse per every village. When I tell village, there could be villages with even 100 people population, 1000 people, one nurse. That's all we need to take care of at least this big menace, single largest menace. I don't know how many of you are aware, 75% of the hospital bills are only because of the uncontrolled diabetes. So that is supposed to be understood that seriously. So one nurse per village, so create 100,000 jobs, 1 lakh jobs, each taking care of 1000 patients. I think we have solved the problem. That 1000 patients, even if they spend 250 rupees per annum, that is the income for that individual, because we can't keep on doing everything that long. Charity, sustainable charity will work wonderful. As I said, all costs are HR costs. I've done a few innovations in thyrocare. I'll just take another 3 minutes. I'm sure that will make a lot of sense for you people to understand how I became a magician here. Because a man who invested 2 lakh rupees into business could exit at $1 billion market cap. A boy who went to Mumbai with 500 rupees in his pocket could create a 5,000 crore single check, which all means that was some kind of magic. The magic was not very great. Just focus. In a 100 kilogram body, I only focused on thyroid. 15 gram gland. There is no one today, as on today, reported that they died because of thyroid problem. And I created $1 billion brand. Many other diseases kill within 10 days or even within sometimes a couple of days. Focus. I focused. Number one. I ran a very frugal operation. Trust me, I have done a Ola. Until Ola came into the country, taxis were standing for 20 hours, running for 4 hours. Afterwards, they are running for 20 hours, standing for 4 hours, so are thyroid testing machines. I have done a Walmart. Walmart never charges too much from the customer, but he squeezes the vendor using the volume. You cannot squeeze a vendor without volume. I have done that. I have done an Amazon. From 10 countries, you can order in the website. My man will come to your door very next morning. I had created a restaurant and kitchen model, which is there, was there in Tamil Nadu, Annapurna brand, which in 70s that man created a centralized kitchen and 10 restaurant. I studied, why can't laboratories from my village? Why can't I create a laboratory where blood is collected is a restaurant, where test is done is a kitchen? Trust me, I ran a centralized laboratory for 10 countries sitting in Mumbai. I created a franchisee model. First time in the healthcare franchisee model I introduced, where you can't go everywhere in the country. A Madarasi cannot do business in Punjab and Bihar. So I had to appoint local man and a franchisee concept. I shared a profit margin. I gave him 60% margin when everyone was giving only 20% margin. He never slept. I beautifully slept. So lot of things I have done, such wonderful innovation. I am sure making a healthcare to reach to the nooks and corners is never a problem, simply because in entire healthcare, India is cheapest. In the entire world, India is cheapest. In entire India, I was the cheapest. And my balance sheet has got 40% profitability. I must tell you here, everybody was envying 40% profitability. So everything is possible. And let me conclude my talk with 2 things. Number one, I used thyroid as my vehicle. Thyroid never made me rich. Wellness, Arogyam profile I created. Thyroid gave me the backbone of network across the country. I shared so much of margin in thyroid. Everybody became a member, almost 5,000 outlets across the country. Now the vehicle is ready. Then I introduced Arogyam as a wellness package, and I created lot of prosperity money for my investors. Is that clear? Let me also tell you, there is no money in water in the river. The sand is the money. And if the water doesn't come, sand doesn't come. I'm from a village. I didn't study this in any MBA college. So I could manage to get it. Now let me tell you, diabetes is the next vehicle for social impact. Touch the hand of every individual and tell what is the problem if there is a problem. You could get the trust of that individual. And trust me, that individual who has touched that hand will have a livelihood for the rest of the life, and we have impacted the society. Thank you very much for inviting me, and thank you very much for giving me the first fresh audience to listen to me. And it's my wish, it is my commitment that I will do my best in this mission. And once again, thank you. Thank you.
Thank you, Dr. Velumani, for your inspiring talk and your insightful thoughts. On behalf of all of us, we would like to extend a token of our appreciation and gratitude to Dr. Velumani. On behalf of all of us, I request Sadguru to deliver the inaugural address.
It is said in our culture, Dharmartha Kama Mokshartham Arogyam Moolam Uttamam. As Indians, we believe in 4 goals of life: Dharma, righteous living; Artha, earning wealth and whatever we need to sustain ourselves; Kama, fulfilling right kind of desires; and Moksha. Ultimately, all these should lead us to our emancipation, liberation, whichever way you call it. But for all these to happen, the fundamental requirement is good health. So today we all have gathered here on this very auspicious morning from all parts of the country and from various fields of healthcare. As our Dr. Sreenivas put it very nicely, that we are all stakeholders, we are all partners in this. And most of the time you are the people, the technologists, the pharmaceutical people are the unsung heroes of hospitals who are never known, who never seen, but nevertheless they help us deliver care to the needy patients. So to all of you, most warm welcome on this cold morning in Sathya Grama. This is a place, as Sreenivas put it, a sacred place, was founded by Bhagavan Sri Sathya Sai Baba in 1978. Since then it was in education, and thereafter it has slowly moved into healthcare, and now into healthcare education, a combination of both. We have Dr. Velumani this morning. I was very pleased to meet him a couple of weeks back and listen to his ideas. And today, this morning, he put it so succinctly. Not just a business model. That is important for people who are in business. They must generate wealth. That is their bounden duty. But at what cost and how it should be done based on dharma, and how the business can impact the overall wealth of the nation, prosperity of the nation, by bringing livelihoods, by bringing knowledge of one's own disease, so that one can take precautions, one becomes employable, useful to the society. These are all other aspects of running a business, whichever business it is. And he has proven this model, and I'm very inspired by his idea that a village boy from a family of a landless farmer and no income mother, and all the children could go on to do so much. That talks about one's will. Where there is will, there is way. And he has both the will and also he knows the way, that as he described in his speech in the keynote address. And I'm sure it is a business lesson for many of you who are running your own businesses in various parts of the country. So we are very thankful to you, for coming here and sharing your valuable thoughts. And we have plans to work together as an institution to do more for the country. He told me, Swamiji, with very efficient model that he has built of Thyrocare, he could reach out to so many people around the country. And there has to be a component of profit. Despite lowering the costs, increasing the volumes, there has to be a profit margin, otherwise nobody will work. Despite that he has reached that far, he told if you are doing it free, you can only imagine its immense potential, how far it can reach, because you don't even have to worry about that count or the calculation of the profit margin. So you can go even far because your costs will become even lower. And that is something we want to learn from him as to how to take diagnostics to the doorsteps of rural India, mainly rural India, because urban India will find some center nearby, but the rural India is the one which suffers the most. And India lives in its villages. It was true in 1947, it is true even today. And if you want to impact the overall health and wealth of India, you have to impact the rural India. That is where your next generation of students, employees, doctors, professionals, politicians, leaders, businessmen, all are coming from, because that's where most of the children are born. Urban people are shying away from having children, but the rural people still go on with their old traditional values, and children are a must. So that is where most of the India is going to be. We are almost overtaking, and I don't know whether we have overtaken China, but in another, let's say 2050, maybe 12 to 15 billion people in India alone. And all these new people who are going to be born between now and the next 25 years are mostly going to be in rural India. So that is where your next market comes from. Even if you're not interested in charity, you must be interested in rural India, because that is where your businesses can thrive. But we are talking about a model, can the businesses and charity work hand in hand? Are they complementary or are they competitive? Are they mutually exclusive or are they inclusive is something that we would like all of us to think today. As industry, as people in the pharmaceutical industry, which has come a long way since independence. And India is known as the pharmacy of the world now, because it is the largest manufacturer of most of the generics and also all other kinds of vaccine for that matter. India has half the share of the world. And that all has happened because of the indigenous intelligence that lies in India and the sense of entrepreneurship, enterprise that is unique to Indians. And you all have made a big difference to the world. Definitely we would not have operated the way we are operating today post-pandemic, but for the contributions made by the various stakeholders in the healthcare sector, from the person, the front-end nurse, to the doctors, surgeons, to all healthcare workers, hygiene workers, and the pharmaceutical industry, to the technology, healthcare technology industry, and the governance. Everything has come together. Everybody came together during the pandemic, and look what we have achieved. We have the maximum number of doses in such a short span, and it is a matter of pride for a country which was looked down upon, that may not be able to achieve anything. It's achieved a lot, and pharmaceutical industry, healthcare industry is bound to grow because population is bound to grow. It's directly related to that. You have more number of consumers in India, naturally more product consumption, more services. So it is a sector that is anyway bound to grow. My only question is that, can we make this growth all inclusive? Can we engage and embrace everyone into this, even those who cannot pay for this? Can we also make them our part of us and not let them fall through the cracks? That is the idea of this discussion, this conference. As an institution, we completely believe in free healthcare, free education, free nutrition. These are the three verticals we work on. Simply because these are the things which I feel are fundamental rights of every human being. Somebody is hungry, must get food, some way or the other. Somebody who is sick must have access to healthcare, affordable, accessible healthcare. And everybody deserves education. Nobody can deny it. If we were not educated and healthy and well fed, I hope you all had breakfast, we wouldn't be sitting here in this hall. We wouldn't be at peace. So that is basic. So we work in nutrition, which is preventive healthcare in a way. We talk about hidden hunger. And India is facing huge backlash from the world agencies when it comes to malnutrition in children. We are one of the worst countries, performing countries in nutrition side. So we have nutrition products. You have nutraceuticals. This all comes together to provide for the children of the country. And they are healthy children. They can get educated. Only if they get educated, are they employable. Only when they are employable, they can be earning members. Only when they are earning members can they consume, pay for the products and services. Only then country can prosper. So it all goes down to something as simple as nutrition to begin with. and then healthcare, and of course education. So these are the three verticals which we have kept it completely free, and for the reasons that we all would surely agree upon, that all children deserve these three things. I call them as fundamental rights of every child born on this planet, not just India, not just in a rural or urban family, but every child deserves this. Unfortunately, these three have been commoditized, commercialized, and that is where the problem lies. Food is sold and bought, and those mothers who can afford highly nutritious food mixes which are available, like in America after COVID, there was no infant formula. And it was a huge disaster in America because they can't survive without it. In India, there is nothing like instant formula for our infants. If mother's milk is there, that's the best that they can do. Otherwise, most of the children grow up in ragi or some red rice. And no nutrition. That is hunger, but not the hidden hunger is not taken care of. So as pharmaceutical industry, as nutritionists, as nutraceutical industries, you can think of something to do with us. We already have a nutraceutical product, which is a combination of several ingredients that takes care of the micronutrition in children. It may not necessarily solve the hunger problem, but it does take care of the hidden hunger. Then we have the education programs across our institutions. All the education is free. Our university provides completely free education to all boys and girls, and including residential facilities, food, clothing, books, everything. And I'm sure Dr. Velumai will appreciate it so much because he knows the struggle of coming up hard way to get an education, higher education. In India, most of our higher education enrollment is less than 25%. And women's education is even worse. In rural India, only 1% of women go to higher education institutions. It means 50% of India's potential, which is women, is lost, is wasted. And most of these women are also not healthy. Many are anemic. You must be knowing about it. Malnutrition and anemia are two things which are pulling down the country's progress. You want to be a $5 trillion economy, but it can't happen just at the top level. You must engage and involve everybody and make it inclusive. So rural healthcare, rural education is definitely the high priority. Governments are working towards that, but just that won't achieve it. 75 years of independence, we haven't achieved it. It's very difficult to achieve it in the next 25 years just by the governments. So we have a model, Sarkara, Samaja, Samstha. I call it a tripartite model. So far it was public-private partnerships. Somewhere it has worked, somewhere it has not worked. Even in healthcare, public-private partnerships had their own successes and failures. But I call it now public, private and people's partnership. We engage everybody, involve everybody into it. So we as an institution have the passion to do. Government has right kind of policy, public sector has policy, and private institutions like all of you who run industry, who run various kinds of businesses, you have the right kind of the potential, the resources to engage with us. It could be your knowledge, it could be skills, it could be training programs, it could be the wealth. So the CSR is a very important aspect of public service now, which is mandated by the government in any which ways. So these are all things that come together to make a healthy nation and a wealthy nation. And in Amrut Kal, the next 25 years that country talks about, truly it can become Amrut Kal if we all come together and not leave anybody behind. The policy should be let nobody be left behind. Everybody should be included in it. Any child born in the remotest northeastern tribal village must also have access to education, nutrition and healthcare and become a contributing citizen of the country. So this is our vision, this is our mission, and we are most happy to welcome all of you to be a part of this wonderful mission that is going on. And the next big step that we are taking, it's a giant leap, I would say. Leap of faith is making medical education totally accessible, affordable, actually free to everyone. There are different ways of doing it. We have thought about it, thought through it, and we are working on certain parameters and policies to enable that. But largely medical education means a teaching hospital. A teaching hospital means you need to engage all kinds of departments. It's a very large setup. So from a single specialty, mostly we are getting into multi-speciality now. From pediatric cardiac care, mother and child care, now to all kinds of care. Running a big hospital has its own challenges, but a large portion of the resources of a running hospital is pharmacy, consumables, and that's where most of you come from. So please do think about how we can help the medical college hospital not have to pay too much, in fact, if possible, nothing for its pharmacy. That will straight away reduce the operational cost by 25%. What can we do? How can we make inventory management can be better? And many other ways we can innovate to find out how pharmaceutical and healthcare industry, including technology industry, can help us. make the college very efficient. I hope this college will produce nurses, as Dr. Velumani was saying, 1 nurse per village. And that's definitely possible, provided you give them the opportunity to get educated. See, the ball stops rolling when they tell you have to pay for your education. Which nurse is going to pay for the education? So we have a nursing college too under the same university, which is also free. We have a paramedical college, which is also free. And rarely a medical college starts a nursing college, or a nursing college starts a paramedical college. They all work in silos. But we want to bring all of them together under one roof. So that doctors, nurses, paramedics, those who work as a team in a hospital, they all work together from the day one. And that will help us to put at least one trained paramedic or a nurse in every village, so that village and the nearby villages can be taken care of. Preventive healthcare is the way. That's not possible unless we have lot many people or technology to help us identify the problem early and solve it or nip it in the bud. That is the way we are looking at the entire structure of this healthcare. I'm sure we have lots to learn from all of you. You have been in the field, you know the markets, you know the industry, you know the nation better in the rural areas, what works, what does not work. And I'm only looking forward to a day, 100 years of independence, that no child, no Indian should be denied or deprived of these basic fundamental requirements like nutrition, education, and health. How can we achieve that? We can achieve it by partnership, by collaborating, by letting all of us work together, breaking our narrow boundaries, and think bigger, think in a selfless way. I'll leave you with one thought. We want to see a India which is healthy, wealthy. You know, the difference between an illness and wellness is only one. If you put I, it is illness. If you put we, it is wellness. So if we become we will create a India full of wellness. So this seminar, this conference is about how can we work as we and not as I's. And that is what will create wellness. I wish you all the best for the conference. And I hope to see you again in the afternoon. I'll be back to answer any queries that you might have on what we are doing. And I may be able to ask questions too, I hope, from your way. Nevertheless, the keynote address has given us a lot of insights, especially the value system that Dr. Velumani has put in his own company. And that is a proven model. It's there for all of us to see. And that is something that inspires us. As charitable organizations, we need to be even more frugal and even more efficient. We understand the value of every rupee, every hour. So we'll have to learn a lot from you. And I look forward to working with you, Dr. Velumani, in such a way that we can take diagnostics to the doorstep of every Indian. And nobody needs to walk even more than 10 kilometers to access healthcare. So that is the idea. Every 10 kilometers, there should be a possibility of one person accessing healthcare. And over the period of time, the larger vision, in every district, we want to set up a center, medical center like this, which starts with preventive healthcare and eventually even curative operative work can be done. And similarly, in every district, we want to set up an educational center, which embraces the children of all the nearby villages, taluks, so that they are all getting educated. Nobody is sitting at home idling away, because that's a huge loss of human resource. That is what he said. Our human resource can be our biggest strength if they're educated, they're employable, they're skilled, they're healthy. But same thing, the demographic dividend can become a ticking time bomb if they are not educated, they're not healthy, they're not having value system, they're not hardworking. The same thing can work against us. So it is for up to us to make it work for us or against us. And in this mission, we are all together. And this is the vision that we have. And I look forward to working with all of you. And I appreciate your time for coming here on a Sunday. And you're all busy people. You have 100 things to do. But you have still found that this cause is worth it. And we must spend our time and energies on this cause and this understanding. So I very much appreciate that. And I appreciate the hard work of all the people who have organized this conference. And I hope your stay and your food and all arrangements are comfortable for all of you. And if there is anything missing, do let us know. We'll make it better the next time. Thank you for your time and look forward to a productive day. And I hope at the end of the day, I have a very good model, a solution for what we are trying to do for the country. Thank you very much.
A collective gratitude to Sadguru for his most valuable insights and showing us all the way forward. With this, we conclude the inaugural session and we will commence the technical sessions shortly. Thank you.
They are getting up as mark of respect now, so I can't tell them to sit there.